Hi aspirants, I'm Dr. SOHINI Untitled intern from Malay Dental College for Women, and today I'm going to discuss and emphasize about shock and also solve few MCQs which are repeats in basic PG entrance examinations. So let's get started into the video now. So what are the contents I'm dealing in this video? Introduction, definition, classification, pathophysiology, stages of shock, general features, types of shock, dental considerations, management in dental office, and finally summary. Okay, so what is shock? Shock is a pathophysiological condition clinically recognized as a state of inadequate perfusion. It is a life-threatening condition because if it is left untreated, it cannot be reversed and leads to death of the patient. And mortality rate here is 20% due to shock. Coming to definitions, Davidson gave this definition. Shock is a term used to describe clinical syndrome that develops when there is a critical impairment of tissue perfusion due to some form of acute circulatory failure. Okay. Coming to pathophysiology, inadequate blood flow leads to inadequate nutrient supply to the tissues, which leads to inadequate removal of cellular waste products, and finally disruption of vital organ functions and death of the patient occurs. A detailed description of pathophysiology we'll see here. Due to inadequate perfusion, cell hypoxia occurs, which leads to energy deficient and lactic acid accumulation and fall in pH. Lactic acid accumulation means it is anaerobic metabolism, and due to fall in pH leads to a metabolic acidosis. Cell membrane dysfunction and failure of sodium pump happens, and intracellular lysosomes release and digestive enzymes release, which leads to toxic substances which enter the circulation, and capillary endothelium damage, destruction, dysfunction, and cell death happens finally. Coming to types of shock, according to etiology, shock is divided into hypovolemic shock, septic shock, cardiogenic shock, and others like neurogenic, traumatic, anaphylactic, which are equally important. Next, based on the pathophysiology and hemodynamic changes, Blalock gave this classification, that is obstructive, cardiogenic, hypovolemic, dissociative, distributive, and neurogenic. What comes under obstructive shock? Cardiac tamponade, pneumothorax, pulmonary embolism, congenital heart diseases, hemorrhage, blood loss, burns comes under hypovolemic shock, sepsis, anaphylaxis, drug injections comes under distributive shock. Okay. Next, what are the stages of shock? First stage is non-progressive compensated stage. Next is progressive decompensated stage, and third is decompensated stage where it is irreversible. So what are the general features of shock? Hypertension, tachycardia, oliguria, cold skin, rapid and shallow respiration. For other clinical features, look at the picture: fast pulse, dizziness, enlarged pupils, drowsiness, shallow and rapid breathing, excessive sweating, nausea and vomiting, blue or gray fingernails or tips, cold and clammy skin. Okay. Next, coming to hypovolemic shock, it results from decrease in the circulatory or effective intravascular volume. Okay. This type of shock is due to loss of intravascular volume. It is clinically manifested by low cardiac output, tachycardia, and low blood pressure and vasoconstriction, revealed by cold and clammy extremities. This is the most common type of shock in trauma. What are the types? Two types: hemorrhagic and non-hemorrhagic. What are the causes of hypovolemic shock? For hemorrhagic, most common cause is trauma, where severe blood loss is seen, and also in GI bleeding we can see this hemorrhagic shock. Whereas in non-hemorrhagic shock, it is caused due to vomiting, burns, diarrhea, and polyuria. Okay. Next, what is the pathophysiology? Due to severe blood loss, hypovolemia occurs. This decreases the venous return, decreased preload, decreased cardiac output, hypotension, perfusion failure, and tissue hypoxia, organ dysfunction, and multiple organ failure, which leads to death. Coming to hemorrhagic shock, it is classified into 4 classes based on the percentage of blood loss. In class 1, 15% of blood loss, that is less than 750 ml of blood is lost, and here blood pressure is normal and mental status is slightly anxious patients. And in class 2, it is also called as mild shock, where 15 to 30% of blood loss is seen, and other common features like extremities, or particularly the feet, become pale and cool, sweat in the forehead, hand, and the feet. Patient feels thirsty and cold. Urinary output, pulse rate, and blood pressure remains normal, and patients are mildly anxious. And in class 3, 30 to 40% of blood loss is seen. This is also called as moderate shock, and there is a decreased blood pressure. Along with the above findings, there will be oliguria, pulse, in pulse is increased, but usually less than 100 beats per minute. Okay, and patients will be anxious and confused. In class 4, more than 40% of blood loss is seen, that is more than 2000, and blood pressure will be decreased, and mental status is confused and lethargic. Coming to treatment, first vital signs must be monitored. Replacement of fluids, transfusion of blood or 2 to 3 liters of crystalloids is the most common treatment, and such as normal saline or Ringer's lactate solution must be given. Ringer's lactate solution is also called as Hartmann's solution, and it consists of sodium, potassium, chlorine in the concentration similar to the plasma. So it is the best and ideal treatment for hypovolemic shock. In patients with moderate to severe shock, fluid therapy is monitored by right heart catheterization, which is done by an inflated balloon with a small wedging into the arterial branch. It is done by Swan-Ganz catheter. We'll discuss later. Cardiogenic shock, it occurs as a result of inadequate cardiac output, impaired oxygen delivery, and reduced tissue perfusion. This shock is caused by myocardial infarction, arrhythmias, cardiomyopathy, aortic stenosis, aortic regurgitation, ventral septal defects. Okay, this is usually caused by injury to the heart. Okay, and in these conditions, the heart, mainly the left ventricle, fails to pump the blood. Okay, what is the treatment for this shock? First, identify the cause and maintain the systolic blood pressure and cardiac output. Most important is inotropic drugs. Dopamine is the drug of choice for cardiogenic shock, and other drugs like norepinephrine and dolbutamide can also be given. Coming to neurogenic shock. Okay, it is primarily due to blockade of sympathetic nervous system, resulting in the loss of arterial and venous tone with pooling of blood in the peripheral venous system, and which leads to extremities will be warm. Okay, generally we have seen the general features of shock where the extremities will be cool and calming, whereas in neurogenic shock, due to peripheral pooling of blood, there will be a warmness in the extremities. Okay, so treatment includes excessive volumes of fluid must be infused, and other drugs like norepinephrine or phenylephrine can also be used. So neurogenic shock is probably the only form of shock that can be safely treated with vasoconstrictor drug. Coming to septic shock, this is the most often due to gram-negative septicemia. It may also occur in cases of severe septicemia, cholangitis, peritonitis, and or meningitis. Okay, these bacteria and harmful toxins which circulate in the blood leads to leaking of blood vessels, and this blood enters the organs and causes the organ dysfunction, which leads to death finally. Okay, this is the pathophysiology of septic shock. And what are the steps? There are 4 steps in sepsis. First is SIRS, that is severe systematic inflammatory response syndrome, where the patients will be more presented with high temperatures like more than 100 degrees Fahrenheit, or with low temperatures, that is 96.8 Fahrenheit or below, and respiratory rate is increased, that is more than 20. Heart rate is increased, that is more than 90 beats per minute, and WBC count is also increased more than 12,000, or it also decreased, that is less than 4,000. Okay, next comes the stage is sepsis, where SIRS plus confirmed or any suspected infection is present in the patient, and this leads to severe sepsis, where sepsis plus signs of end organ damage can also be seen here. And lastly, septic shock occurs, where severe sepsis is with persistent signs of end organ damage, and hypotension is seen here. Okay, systolic blood pressure is less than 90 mmHg, and lactate concentration is more than 4 millimoles. Okay, these are the steps of sepsis. Coming to treatment of septic shock, first line is aggressive volume expansion, mechanical ventilation. Second line is inotropic drugs. Plasma expanders can be given. Activated proteins can also be given. Antibiotics and surgical debridement is must to control the infection. And most common cause of death in septic shock is hypotension. Okay, this is an important MCQ. That is most common cause of death in septic shock is hypotension. Okay. Anaphylactic shock. This is seen in administration of penicillins or serum or dextrose or any other anesthetics. Okay, such shock is usually caused by bronchospasm, laryngeal edema, respiratory distress, which leads to hypoxia finally. Okay, symptoms, signs and symptoms include itching, severe itching, pruritus, headaches, edema of lip is most common, and SOB, shortness of breath, is also common, and other signs can also be seen. It occurs due to increased release of histamine and slow release of substances or other mediators by combination of antigen with IgE on mast cells and basophils. Okay, so let's see the pathophysiology in detail. Antigens are introduced. This go and binds to which leads to B cell production, and plasma cells produce IgA antibodies, which goes and binds to the surface of mast cell or basophil. On subsequent exposure to the same antigen leads to antigen bridges, the gap between the two antibody molecules. Degranulation of the cell happens, and release of histamines and other mediators can also occur. What happens if histamine is released? It increases the permeability, and distension of blood capillaries occurs. Okay, this is the pathophysiology of anaphylactic reactions. And treatment, first and foremost, is monitoring of vitals, that is circulation, airway, and breathing. Next, administration of epinephrine subcutaneously, and IV antihistaminics can also be given to reduce the allergic reaction, and oxygen ventilation must be given. Okay, so what are the dental considerations in shock? We have seen the types of shock in detail, and now we will deal with the dental considerations in shock. So before starting the treatment, we'll get to know the diagnosis and treatment plan, and we'll get to know the history of allergic history of patients, and we'll see the systemic review. Okay, next, LA. So most common allergic component in the LA is its preservative, that is methylparaben. Okay, this causes the allergy in most or few patients. Okay, and pain also. Anxiety on vision of dental instruments. This is most commonly seen. Some patients will be becoming anxious on this side of the instruments, or side of needle, or even side of loading the needle also, they become anxious. Okay, shock and syncope due to longer durations of treatment. Okay, due to longer durations of treatment, patients will be sitting in the same position for a long time. This also leads to syncope. Okay, management in dental offices. First, if we see any symptoms in the patient, first and foremost thing we have to do is terminate the dental position then and there. Okay, next, position the patient in supine position by lowering the chair, and basic life support must be given if any indicated situations are there, and definitive management must be given by observing patient and administer any specific drug which treats the disease or condition. Okay, and then next, emergency must be called, medical consultation, and we have stopped the treatment there, so we have to complete it. So we have to give the further appointments for the completion of treatment. So this is the basic management of any medical emergency. Next, coming to most important topic here is pulmonary capillary wedge pressure. It is also called as pulmonary wedge pressure or cross sectional pressure. Okay, this is the pressure measured by wedging a pulmonary catheter with an inflated balloon into the small pulmonary arterial branch. It estimates the left arterial pressure. Okay, so this is the best indicator for blood volume and left ventricular function. So normal PCWP value is in the range of 6 to 12 mmHg. Okay, this is an important question. That is the most normal range of PCWP is 16 to 12 mmHg. Okay, it is obtained by Swan-Ganz catheter. Here I have mentioned the diagrammatic picture of Swan-Ganz catheter. It has two ends. One end is blunt, and other end we have balloon which can be inflated after entering into the arterial branch, and we have thumb is a distal port at the tip, and proximal part, that is 30 centimeters away from the tip. Okay, diagrammatic question can be given, so take a minute and have a look on this Swan-Ganz catheter. Okay, and few more points on Swan-Ganz catheter. It is introduced into the CVS mostly through right internal jugular vein. This is the important question, that is Swan-Ganz catheter is introduced into the CVS mostly through right internal jugular vein, and it is used in sophisticated centers to get valuable information about the precise diagnosis and circular derangements of shock. It provides three types of information: flow in the cardiovascular system, accurate measurements of blood gases in mixed venous blood can also be estimated, and feeling pressures of both right and left ventricle, left sides of the heart can also be estimated through Swan-Ganz catheter. So most important here is normal range and diagrammatic picture, and introduced into the series through right internal jugular vein. Okay, next let's solve the few MCQs now. Okay, first question: hypertonic solution is given on all conditions except. So we'll come option wise. First is prolonged bowel surgery, brain injuries and burns. Next, cardiogenic shock. Okay, in prolonged bowel surgeries and burns patient and brain injuries, hypertonic solutions are given so that they reduces the edema formation. This is the most important treatment in treating this prolonged bowel surgeries and brain injuries and burns patient. Whereas in cardiogenic shock, mainstay of treatment is administration of inotropic drugs, that is dopamine. Dopamine is the drug of choice for cardiogenic shock. Okay, next question: first sign in shock, hypertension, syncope, tachycardia and hypertension. So in shock, what are the general features we have seen? Tachycardia, hypotension, oliguria, cool and clammy skin, and rapid and shallow breathing and excessive sweating. So what is the first sign is hypotension. Next question: normal PCWP value is. Okay, I have already discussed this question. Normal range is from 6 to 12 mmHg. So let's come option wise. First option is 12 to 30 mmHg. Next 8 to 12 mmHg, 4 to 9, 10 to 20. So most appropriate answer here is 8 to 12 mmHg. Okay, what is the next question? Which of the following is common in all the types of shock? Hypertension, hypotension, bradycardia and vasoconstriction. I have already discussed this. Hypertension is the most common in all the types of shock. Okay, it is the first sign and it is the most common to all the types of shock. Okay, and most common cause of death in septic shock is also hypertension. Next question: plasma expanders are used in septic shock, neurogenic shock, anaphylactic shock and traumatic shock. Answer is septic shock. Okay, in septic shock, what is the treatment? We'll discuss in detail. So first line is aggressive expansion of fluids, and second line is inotropic drugs. We can give plasma expanders, activated protein C, antibiotics and surgical debridement to control the infection. So next is neurogenic shock. What is the treatment? We can give excessive volumes of fluid, and also epinephrine, norepinephrine or phenylephrine can also be given. In anaphylactic shock, IV epinephrine, IV antihistamines or subcutaneous epinephrine and administration of oxygen must be done. In traumatic shock, depending on the cause, if there is severe blood loss, we have to administer fluids. Okay, next coming to most common parenteral fluid used in the hypovolemic shock: isotonic saline, dextrose, ringus lactate and plasma albumin. Let's discuss option wise. First is isotonic saline. It is used in 0.9% concentration. It has high concentrations of sodium and chloride. It is given in dehydration, vomiting, gastric or duodenal aspiration situations. Okay. Next, dextrose. It is given in 5% and it is given in hypoglycemic condition. Okay. Next is ringus lactate. It is also called as Hartmann's solution. It contains sodium, potassium, chlorine in the concentrations similar to that of plasma. Okay, it is the best and ideal treatment for hypovolemic shock. Fluid replacement is the most important step in management of hypovolemic shock. Okay, a non-sugar, non-protein crystalline solution with a high concentration of sodium, approximately that of plasma, is preferable in the initial stage of fluid replacement. So that solution can be ringus lactate. It is also called as ringus acetate or Hartmann's solution. And it is supplemented with 1 or 2 ampules of sodium bicarbonate. Okay, resuscitation should always be started with such crystallite solution even if the blood is available. If resuscitation is started with a acidotic whole blood with a high concentration of potassium concentrations, efficiency of myocardium is tremendously jeopardized. So Ringer's lactate is the best and ideal solution for treating hypovolemic shock. Next is plasma albumin. It is given in 4.5 percentages and it is given in severe burns patients. Okay, clear? So that's it. Thank you, and we'll have a quick recap on shock. Okay, what is shock? It is a pathophysiological condition and life-threatening condition. Mortality rate is 20%. Pathophysiology due to inadequate blood supply, inadequate nutrient supply leads to inadequate removal of cellular waste products, leads to disruption of vital organs functions, which leads to death. Finally, types of shock: hypovolemic, cardiogenic, septic, anaphylactic, neurogenic, traumatic. Okay, next we have seen the stages of shock and clinical features of shock, that is hypotension, tachycardia, and oliguria, cold and calm skin and extremities, and rapid and shallow breathing, excessive sweating. And we have seen the each treatment of each shock, that is hypovolemic shock and its classification. Treatment is administration of fluids and vitals must be monitored. And anaphylactic shock, epinephrine and IV antihistamines. Cardiogenic shock, dopamine is the drug of choice. Neurogenic shock, norepinephrine or phenylephrine is a drug of choice. Any vasoconstrictor is safely used in treating neurogenic shock. And in septic shock, we have seen first line, second line, other plasma expanders, and antibiotics and surgical debridement to control the infection. And next we have seen the dental considerations and management in dental offices, and also we have discussed the important concept, that is pulmonary capillary wedge pressure, and it is the best indicator for blood volume and left arterial pressure, and normal range 6 to 12 mmHg. And about Swan-Ganz catheter also we have seen, and we have also solved few important questions. And yeah, that's it. Thank you. And finally, if you like this video, please like, comment and share, and subscribe to MDS CONQUER for more informative and NEET oriented stuff. Thanks.